Good evening, class. Tonight I'm going to go through a quick neurological assessment. The purpose of this assessment is to establish a neurological baseline as well as identify any neurological deficits, disorders, or diseases that a patient may have. So we're going to need a few things to do this. It's really not incredibly specific what we need. The most important tool that we will have will be a pen light. We will also need something soft like a cotton ball or a cotton swab, something sharp or pointy. I typically like to use a pen. And then we will need a reflex hammer as well. So we're going to start this off with the most subjective information by asking a patient some questions to determine their orientation and then as well figure out if they have any background or history of neurological deficits. Now, this may look a little bit different from a normal hospital. We had some catastrophic car issues, so this will be taking place in the Bell, West Virginia hospital of my house. All right. Ma'am, can you tell me your name and date of birth?
Erin McDonald, 7/23/93.
Excellent. Do you know what year it is?
2022.
Wonderful. And do you know what county we're in?
No.
Wonderful. So we've just determined that this patient is oriented to place, person, and time. The next thing we're going to do is ask questions about their background or history with any neurological deficits. So do you have any history of extreme headaches, weakness, fatigue, any dizziness, anything like that?
No.
Any vertigo or tingling sensations or loss of sensation in total?
No.
All right, have you ever had a injury to your head or experienced anything such as meningitis?
No.
Okay, have you ever had any surgeries on your head or back?
No.
Okay, excellent. Now that's only some of the questions that we can ask. A lot of this can be tailored to your specific patient and can also be focused on in specific ways. So the next thing we're going to do is move to the slightly less subjective but still fairly subjective portion of this test where we're going to be observing the patient. One important thing to note with a neurological assessment is that even while we're performing assessment where we either are doing something to or with the patient, we're asking them questions, we're also going to be observing how they respond to us, how quickly they respond, any way that their speech patterns may differ from normal. Basically, we're looking holistically at the patient to see if there's anything that we would think stands out as something that might be neurological in nature. So again, looking for slurring of speech, maybe weird movements of the eyes or a pause before reactions to questions, etc. So I'm going to start out now. We're going to go with sensation first. So I'm going to be using a cotton swab. You can again use a cotton ball if you want to, a towel, anything kind of soft is what we're looking for first. My pen for me. Okay, so I'm going to start by asking the patient to close my eyes, and I'm going to run this cotton swab down various portions of their body and ask them to identify them for me. Okay, can you tell me where this is?
Left side.
Okay.
Right.
All right.
Right arm.
Okay.
Right leg. Left leg.
Okay, excellent. And so we can of course continue through every portion of the body with that. The next thing that we'll do is we will ask about the difference in sensation. So we're going to see if there is a mirroring of sensations across the body part and if they feel similar. So again, I'd like you to close your eyes and I want you to tell me if where I touch you feels different on either side of the body. So we're going to start here. And does that feel any different than this?
Nope.
Excellent. Does this feel any different than this?
Nope.
Okay, same question.
Nope.
Okay. Wonderful.
Nope.
Same. Okay. Perfect. So we have identified that there is a pretty even base level of sensation across both sides of the body. The next thing that we're going to go for is to look for pain or a sharpness sensation. So again, you can use a variety of things, a toothpick or any number of slightly sharp objects. I like to use a pen with the tip retracted because it's relatively safe and still will identify what we're looking for. Okay. Can you feel this? Okay, can you tell me where?
Left cheek.
All right.
Right cheek.
Okay,
Left arm. Right arm.
excellent. And does this feel soft or sharp to you?
Sharp.
Okay, wonderful.
Sharp. Sharp.
All right, excellent. Now one thing that we can do, and one big part of this is that you can do a lot of this in really a lot of orders. So since we're down at the feet and I do have my pen on me, we're going to test the Babinski reflex. And we're going to look for the toes to grab in towards the device that you're rubbing on the bottom of the foot from the heel to the toes. A positive sign that is not good is a reflex of fanning out of the toes, and we don't want to see this in anybody over the age of 2 years old. So again, you're going to take the pointy end of your device, go from the heel up towards the toes. And some people are a little bit ticklish. Again, primarily we just don't want to see fanning with this. Okay, and I did see a little bit of retraction of the toes, so that's exactly what we want to see. Okay, now the next thing we're going to do is we're going to test, I'm going to put that back down. So we're going to test for graphesthesia and stereogenesis. And so what these are is graphesthesia is the ability to identify a shape that is drawn in the hand or somewhere on the body, and stereogenesis is the ability to identify a thing that you should be familiar with. So can you show me your hands? Okay, can you close your eyes for me? I'm going to draw a shape in your palms, and can you tell me what that shape is?
Circle.
Excellent.
Triangle.
Excellent. Now keeping your eyes closed, I'm going to place something into your left hand. I want you to identify what it is without opening your eyes.
Pen.
Wonderful. Thank you very much. Okay. And so that for the moment is going to conclude the sensation portion of our assessment. The next thing I'm going to do is I'm going to move to eyes and vision and cranial nerves. And so again, this is the one part that it's super important to have. You need to have a pen light. I also have a secondary flashlight. This light is far too bright to use. And so you really want a pen light that is a warm light color. So first we're going to be looking for pupillary response. So we want to see our pupils equal, round, reactive with light and accommodation. Ma'am, can you stare straight ahead for me? We're going to come in from the sides or the top and the bottom. And we're looking for a constriction of the pupils, first of all. We also want to see them being equivalent bilaterally. And we also want to see when one pupil constricts, the other should constrict a little bit as well. So again, on the sides, we're seeing constriction on both a little bit. They are both equal. They are reactive to light. So that's wonderful. The next thing we're going to do is we're going to check the ocular muscles and watch the eyes follow the light. So ma'am, if you could, can you just follow my light for me? Excellent. And same thing, we're just looking for equivalent reactivity across the eyes. No nystagmus or anything like that. We want to see the eyes move smoothly and with purpose to the same place. Excellent. Okay, now we're going to be looking for vision field. Ma'am, can you cover your left eye for me? And we're going to take our hand and we're going to bring it in towards their vision and see where their vision starts. And we're looking here to make sure that we don't see any kind of shading or differences in visual perception in either eye. Can you tell me when you can first see my finger in your periphery?
Okay.
Okay.
Okay. Okay. Okay.
All right, we're going to do that across both eyes, and then we'll also do that with the eyes uncovered. So can you uncover both your eyes, and I'm going to do the exact same thing.
Okay. Okay.
All right, excellent. So we've got that. I'm going to go ahead and put my pen light up. And now we're going to be looking at, again, cranial nerves and facial muscles. So the first thing I'm going to do is I'm going to palpate the face for the tonality of the muscles in the face. And we're looking, just as always with the neurological assessment, we're looking for symmetry across both. So muscles are feeling pretty symmetrical. So now we're going to ask a series of questions that are going to display motor function. Can you show me your teeth? Excellent. Can you frown for me? Wonderful. Can you open your mouth and stick out your tongue? Excellent. Now can you say "ah" for me? Okay. Now in this moment, you can also use a tongue blade. It really depends on how in-depth you're trying to get with this portion of thing. We're looking for the back of the mouth to respond in a symmetrical fashion across both sides, as well as seeing the uvula move the way that it should. Okay, so we've done that. So the next thing I want to look for is musculature on the face and neck. So I'm going to put my hand up against your face. Can you push towards my hand? Excellent. Same thing over here. Okay, wonderful. I'm going to put my hands on your shoulders. Can you lift your shoulders for me? Excellent. Okay, so now we're going to test audible ability. You can do this with the tuning fork. It's just as easy to do this in practice with the whisper test. So I'm going to whisper a number and I'm going to have the patient repeat it back to me. Ma'am, I'm going to whisper a number. Can you repeat it back to me here?
Three.
Wonderful.
11.
Okay, great. So we've gone through their ability to hear now. And again, you can do that with a tuning fork if there's, if you suspect it's a bigger problem. A lot of this is a good way to find baseline, and then if you do identify a problem that you think is more in-depth, you can go more in-depth with that particular assessment. So now we're going to be moving into the body, and we're going to be looking for symmetry of movement as well as purposeful movement and any kind of differences in the way that the patient displays their movement. So the first thing I'm going to do again is check for muscle tone. And as you're doing this, you'll ask the patient if they have any moments of discomfort or pain. No pain or discomfort?
No pain or discomfort.
Excellent. And we're feeling pretty symmetrical all the way down. Okay, wonderful. And so now we're going to move into actually testing the patient's ability to move their limbs and extremities. Ma'am, can you hold both of your arms out straight in front of you for me? Okay, and we're going to have them do this for about 8 to 10 seconds, and we're going to be watching for drift of either hand or scratching of the nose. And again, looking great symmetrically. Okay, you can put your arms down. All right, now can you lift both of your feet in the same fashion?
Same time?
And this is again much more easily accomplished in a hospital bed. You can also have the patient dangle their feet, whatever would make them most comfortable here. Okay, so now we're going to move to the pushes and pulls, which is something probably most of us have done. And ask the patient to put their hand up like this. Okay, can you push against my hands? Wonderful. Can you pull back against them? Alrighty, now put your arms up like this. We're going to do the same thing. Pull back. All right, now don't let me push you. Wonderful. And here we're also going to test hand strength. Now can you grab one of my fingers? All right, can you squeeze both my fingers? Excellent, thank you. Now with the hands, we're also going to track their rapid active movement. So what I'm going to ask you to do is put your hands flat on your thighs and then flip them over. Okay, and I'm going to ask you to do that 5 times rapidly. Ready? 1, 2, 3, 4, 5. Excellent, and that's showing that they can do rapid motions in sync with each other. Same as before, there's a lot of different ways that you can do that, either moving your fingers like this, any way that you can really identify that they can do this quickly and in sync with both extremities is what we want to see there. Okay, so that is wonderful. Now, can you dangle your legs for me? Okay, so now we're going to do the same pushes and pulls on the feet and legs. So first I'm going to go to the feet. Can you pull up towards me? Okay, now push down like you're pushing on a gas pedal. Excellent. Now put your feet flat on the floor. Okay, push up towards me. Okay, and we're going to put our hands behind the knees. Try not to let me push you up. Okay, excellent. Oh, excuse me. So that we've gone through what we want to see with muscle use. Again, there are a variety of different ways to do this, but more or less we're going to look for everything to be symmetrical across both sides of the body. So now we can move on to our reflexes. And so we are going to start, in this case, with the knees and work our way up. So you want to have your patient have their legs dangling so they're not touching anything. And we're going to check the quadriceps. So we're going to take a knock right at the bottom side of the kneecap or the patella. And you want to see a little bit of a swing here. One thing that you're not looking for is a very exaggerated swing, so they would go way up, or clonus, where we're going to see the leg bounce a couple of times. Those are both indicative of neurological problems. And we see, again, just a very slight swinging of the leg. Okay, excellent. Now I'm going to take the patient's arms. I'm going to have you let your arm at your side there. Now I'm going to grab onto the bicep tendon on the outside of the arm. And this you're really going to feel more than you see. We're going to whack just right inside of that bicep muscle, light tap. Okay? And you can feel that bicep just tighten up just a little bit. We're going to do the same thing bilaterally. Okay? Now we're going to check the tricep, which is the outside muscle. We're going to have you hold their arm out like this. And we're going to place our hand underneath, supporting, and hit right above the elbow. Okay, perfect. Same thing over here. All right, excellent. Sit that down. Okay, now one thing we're gonna do now is we're gonna check the finger to nose and then the heel to shin. And what that's gonna do is just show us that there is the ability to move your hands and your legs in a way that you want them to smoothly. So we're gonna have the patient take their right hand, touch their finger to their nose. Now you're gonna put your finger in front of theirs and have them go back and forth between the two. We're looking for a fluid, smooth motion. Excellent. Now can you do the same thing with your left hand? Wonderful. And this one gets a little bit complicated sometimes. You're going to want to support the patient's leg and then have them put their heel of their other foot onto their knee and then move it towards their shin. Again, just looking for smooth, fluid motion. So I'm going to hold up the patient's right leg. Can you put your knee on? Yep, excellent. Now slide down towards the shin. Now pull back up. Wonderful. We're going to do the same thing on this side. Slide down, pull back up. Excellent. All right. Now, one of the last things that we're going to do in this assessment, and this is something, like I said earlier, you're going to want to watch from the moment you start the assessment, the moment you walk into the room, is we're going to be watching for gait, and this is extremely important. So we want to see how the patient walks. We're looking for any stumbling, leaning, ataxia, anything like that. So we're going to have the patient stand up and go to the opposite side of the room, please. Okay. Now, can you walk to me at a regular pace? Wonderful. Can you walk back that way? Excellent, thank you. Now we're going to want them to walk at a brisk pace. So can you come towards me at a brisk pace without tackling me? Wonderful, thank you. And she's moving purposefully, relatively with ease. We're not seeing any stumbling or any problems staying upright. So now we're going to do what's called the Romberg test. And we're looking here for any swaying or an inability to stay upright. And we're going to do this by asking the patient to close their eyes and stand in place for 10 to 15 seconds. So can you close your eyes and stand in place for me? Excellent, we're not seeing any swaying. What we would not want to see is a patient kind of start to fall to one side or lean back and forth like this. So that's wonderful. You can go ahead and take a seat. Thank you. So this is more or less going to cover the majority of your quick focused neurological assessment. So what we've done here is we're identifying a baseline. All of her responses were what we would expect. Again, just looking for things to be equal bilaterally and to respond in a fluid motion most of the time. One thing that we might not expect that's going to be a pretty obvious one for most people is something like facial droop after a stroke. And so that will occur when you can see a muscular usage of only one side of the face. So one side may stay flaccid. If you ask to smile, you only might get a smile from the one corner of the mouth. And that will indicate that we have definitely had some type of neurological problem occur, be it an injury or, again, a stroke or any number of other things, and that we'll need to dig a little bit deeper. And I believe that's going to conclude our neurological assessment. Thank you very much and have a great evening.